During this episode, we're going to be looking at the effects that the strength training will have on the cardiovascular system and the heart itself, and how the heart is a muscle and how strength training affects the cardiovascular health. So when we actually have a look at the heart sits in our chest cavity, just on the left-hand side underneath the sternum over to the left. The heart is a pump that basically pumps oxygenated blood to the body and deoxygenated blood to the lungs, so the blood can get oxygen and then return oxygenated blood back to the body so that we're able to function correctly. When you have a look at the heart is composed of cardiac muscle. So in the body we have three types of muscle. We have skeletal muscle, which is the muscle that we mainly think of when we think of strength training, that makes up the muscles that move our body. We have smooth muscle, which is the type of muscle that lines our organs such as our stomach and our small intestines. And then we have cardiac muscle, which is the muscle that the heart is composed of. Now when we have a look at the heart's broken up into four chambers. These chambers being two chambers that actually collect blood, they're like a reservoir, and then two chambers that pump blood out either to the lungs or to the body, depending on which side of the heart we're looking at. The heart itself has its own blood supply. These are called the coronary arteries. And when these become blocked, this is when someone is likely to have a heart attack. When these get blocked, you will often hear of people having a bypass where a small vessel will be put in to bypass the blockage in the vessel, so then that way the blood system has another way to travel around the heart. When you look at the heart is responsible to pump blood around the body. Blood comes back to the heart from either the body or the lungs in these two collection reservoirs known as the atriums. Once these are full, blood then goes down into what are called the ventricles, which are the two pumping stations of the heart. When the heart contracts, it then pushes this blood out through those vessels, either to the lungs or the body. Now, when we do strength training causes the heart to work harder. It causes the heart to pump. And this is where, as health and fitness professionals, we need to be a little bit careful with people who have blood pressure issues. Because if somebody has high blood pressure, we need to train them at a lower intensity, because strength training will actually increase the blood pressure in the heart. You'll notice here the thickness of the walls down here in our two pumping stations, in the two ventricles. The more strength training and the more cardiovascular training we do, the thicker these walls and the stronger the heart will come, which means there will be a more forceful contraction and a greater ability to pump blood around the heart and the body. One of the most important aspects in training people and starting to train someone is to actually understand their blood pressure. Now, the medical community, or the mainstream medical community, will state that 120 on 80 is normal blood pressure, and anything below 140 on 90 and above 100 on 70 is in that normal zone. Ultimately, the lower we can get someone's blood pressure, the healthier their heart is. As long as the person's not getting dizzy, and as long as the person's not passing out or having faint spells, the lower the blood pressure is, the better it is. So let's explain how blood pressure works. When we look at blood pressure, we have two readings. We have a systolic reading and a diastolic reading. The systolic reading is the pressure in the heart during contraction. So if we go back to this diagram here, when these two valves here contract and the heart beats or contracts and it forces blood out through these two vessels, that creates a pressure in the heart known as the systolic pressure. Now the second number, or the lower number, is known as the diastolic pressure. This is the pressure in these two chambers when the heart is relaxed. Now, the resting heart rate, or your heart rate, is how many times your heart beats in 1 minute. Obviously, the lower we can get your heart rate, the healthier it would suggest your body is. So when you think about it, if the heart is pumping at 60 beats a minute and it's pushing out through here, so it's ba-dump, ba-dump, as that pushes out and it pumps that blood out, it then has like a second to relax before it has to beat again. Where if the heartbeat's pumping, say for example at 90 or 120 beats a minute, the heart has less time to relax, which will then lead to a likelihood of this diastolic pressure being higher and the heart having to work much harder. Now, in this video, we're only going to talk about 3 things that will usually impact someone's blood pressure. The first of these is the size of a person's body. The bigger a person is, the more plumbing they have in their body. So if you think of the vessels as pipes of a plumbing system, the bigger you are, or the more larger you get, whether it be through fat or through muscle, okay, the further you have to pump blood around the body. The further you need to pump the blood, the harder the heart will have to work to pump this blood around the body. And you see this quite regularly with someone who's overweight. When they drop 10 or 15 kilos, their blood pressure drops because the heart's now not having to pump blood as far around the body as it was before they lost weight. The second thing that will affect the body is fatty deposits in the arteries. So this is a diagrammatic picture of an artery, and this is the hole in the artery that the blood pumps through, and here are the arterial walls. What can happen is if you eat too much of the wrong fat, is the actual fatty deposits can bind to the walls of the artery, forming a plaque. And as this plaque builds up, the hole or the lumen of the artery gets smaller. And just like any blocked pipe, to be able to pump fluid through a pipe, if it's a blocked pipe, you then require more pressure to push that fluid through the pipe. So if you have someone who has fatty deposits in their arteries, and this is something that happens as soon as you start eating processed fats, so it's likely that 99% of people in society have some sort of form of fatty deposits in their arteries. But if you end up with fatty deposits in your arteries, what will happen is these deposits will prevent the ability for the heart to pump blood around the body effectively. Therefore, the heart has to then work harder to pump blood around the body, again lifting someone's blood pressure. Now, by eating good healthy diet, eating good healthy fats, doing regular exercise, so not just exercise but regular exercise, you can reverse these fatty plaques and these fatty deposits, and they will actually clear up and go away. A cardiologist in Sydney named Ross Walker actually has a book called Highway to Healthy Heart, and he looks at 5 steps to help people reverse cardiovascular disease, these being eat a Mediterranean diet, make sure you eat your healthy, which is full of healthy fats, don't smoke, regular exercise, and take time out to reduce stress each day so that you can actually feel better and reduce that stress. And by doing these steps, you will actually reduce these fatty deposits, which will in turn reduce your blood pressure. The last aspect of that we're going to talk about today to help that will impact your blood pressure is stress. When you are stressed, what will tend to happen is your cortisol levels will go up, your hormone levels will go up, your sympathetic nervous system will be turned on, which is the nervous system which drives your fight or flight mechanism. When this is turned on, your heart rate will pick up and your heart will have to pump harder. Once again, if your heart is pumping harder, it's more likely that it's actually going to see an increase in your blood pressure because it's having less time to relax and it's having to work harder each minute to pump the blood. By doing regular exercise, what will happen is you'll have an outlet for your stress, you'll increase the heart, you'll increase the strength of the walls of the muscles in your heart, and the heart will be able to pump more effectively and reduce blood pressure, which in turn will create a much healthier heart. So participating in a strength training program just once or twice a week will actually help strengthen your heart. Partnering this then with some cardiovascular activity such as going for a bike ride or going for a walk or doing some sort of sport will improve the cardiovascular health of your body, which actually will help break down these plaques, prevent fatty deposits, and ensure that you actually have a good healthy heart throughout your whole life. If you'd like any assistance or any further information on how we can help you with your cardiovascular health, jump online to our website lifestyleessentials.com.au or shoot us an email at info@lifestyleessentials.com.au. Thank you very much. We'll talk to you next time.